A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 MP Marisburg 105.6 FM. I'm Shabnam Ismail on the Peter Marisburg Pulse Show, capturing the heartbeat of the community. Alhamdulillah, we praise Allah for the opportunity to share knowledge and insights on health and wellness. So let's embark on this journey together, seeking guidance and blessings from the Almighty. It's the most wonderful time of the year, listeners. Holiday season is here. But amidst the festive cheer, let's not forget to prioritize our health and safety. Today, we're honored to have Dr. Jotika Maharaj, a medical expert who will share valuable tips on how to stay safe and injury free this holiday season. To our listeners, tune in and get ready to enjoy a healthy and happy holiday. Dr. Maharaj, welcome to the Peter Marisburg Pulse Show, and it's really great having you with us.
Thank you, Shabnab. Good morning, listeners, and assalamu alaikum to all our listeners. I'm honored to be here and honored to help with the little bit that input that I have as an expert and a mom and part of the community. And really just let us get ready and be safe and enjoy the festivities, keeping in mind charity and selflessness and not indulging too much. So, yeah, just as a human being, let's enjoy.
Listeners, Dr. Jotika Maharaj is a dedicated general practitioner and someone who's really passionate advocating for ensuring that every person receives care rooted in evidence-based medicine. She believes in being a doctor in the most human way possible, extending compassion and clinical excellence to the community she serves. Dr. Maharaj practices at a local private hospital where she co leads a team of highly driven and compassionate doctors who embody the spirit of Ubuntu, the belief that I am because we are. And beyond the hospital, she continues this ethos at home and in her children's schooling, nurturing a culture of empathy, integrity, and service. So, Dr. Maharaj, tell us a little bit about what you do in your field of medicine.
Well, in my field of medicine, Shabnab, I think I'm more of a person just as a doctor, but more an advocate for public health. I started my practice in 2019 during COVID and the birth of my first child. And as she was 4 months old, I got a practice number and started providing free healthcare to moms and children in the community just via WhatsApp. I would then coordinate their care and make sure we got to the emergency department when we had to and use our funds or our medical facilities correctly. And that practice grew from strength to strength. And now I'm a mom of 3 with a really busy practice where I provide value-based care to the community and care coordinate mainly through WhatsApp at any hour of the day, and I don't charge my patients until they can afford it, and their problem is seen too, whether that be today or a year from now. So, yeah, for value-based care and for really helping the community to know when to seek healthcare and how to seek it correctly.
And I'm sure we're going to share your WhatsApp number a bit later. But listeners, it's such an amazing time of the year. I mean, the kids are out of school. I think that, everybody's got plans, either traveling and planning to get together. But at the same time, this topic and the show today is mindfulness to be safe this holiday season. So, Doc, what are some holiday related injuries you actually see?
Well, mainly I see kids falling off beds, they're jumping. So mainly we'll start with kids. I think they're excited, they're outside, we're family. We need to be mindful of, is someone just keeping an eye on them? And that classic saying, I just turned around, and it really does happen. They fall from a height. So any height they fall above their actual height is concerning. Any head injury for kids, especially with vomiting or loss of consciousness. And any sort of injury where they have bleeding, lacerations. So kids running outside, being with open wounds and getting injuries with plants and sort of stings and things like that. So they get hurt, kids mainly. And then on slides and jungle gyms and things like that. So monitoring kids, I would say, is important and keeping them not too hyper, which is difficult. Then with adults, I think a big one is those fairy lights our dads love on the rooftop. So using a ladder correctly, making sure you're in that 120 kilograms. I know my dad tests it sometime. And make sure you're grounded well. Fear of heights or not. Slippery weather conditions. The weather's been really, really difficult recently, very hot. Also, so with adults, I'd say kitchen injuries as well. Moms rushing, turning around, crowded kitchens, burns, and then sort of not seeing to them quickly. Women tend to do that. And lacerations and amputated fingers, things, carvings and things. So burns in the kitchen are important. Breaking of glass, getting injured. And then another big one is older people. They're more prone to falls. They might be alone. Check on the older people that you might not have near you. Maybe get them in tune with technology. I know they like that. So monitor them if they've had a fall. I know my great grand would fall and the bathroom door would get shut. So that's got a big one. They can't call for help. So elderly and falls. Then another big one is fireworks and things like that, getting burnt again, and electrical injuries. So very important. Then very big as well as road accidents. Be safe on the road, be cautious, and be aware of your fellow driver. So those ones, so big ones are head injuries, electrical injuries, burns, and then obviously drowning and being mindful of water injuries and water sports. Keep an eye on the kids, be there, be present, be aware. We all can sometimes mishaps happen. Also, then sports injuries, we want to do a lot of things. Dads want to play sport with their kids. Be safe, use the correct protective gear, down driveways with that good old black bike we all liked. Try not to be too daredevil like. So yeah, I think outdoors and things mainly, and kitchen.
I know that the housewives are they obviously cooking up a storm and experimenting on new recipes. So, in terms of household cooking, what kind of safety will you advise mums to take precautions?
Well, I've been in the kitchen a lot recently. I know that you can have thoroughfare of kids. So I think mainly keep the kitchen door out of thoroughfare. So no one runs in and out of the kitchen. That sort of cat and mouse through the house kitchen mustn't happen. So try to keep your kitchen out of bounds. Then if you're with your mom and 3 generations in the kitchen, we use behind, like chefs. So behind each other, behind, so not to turn around. Becomes a contact sport sometimes. Then, so appliances, make sure your appliances are safe. Your electricity is safe. Don't overload, obviously. I think women are very good in the kitchen knowing their appliances. And then slippery floors, don't rush. And then burns. So any sort of steam burn and taking things out of the oven, take that time to put on your mitt. I know I sometimes grab a towel or something, or my t-shirt or something, noodles out of the microwave. We're all guilty of it. Hot water burns are very, very awful, and you'd be really in pain. So I think with burns, I would say first make sure you run through some moderate water, not too cold. Don't put on any adhesive dressing. Get to the ED if you have to, or send a picture to me, which would be helpful. And make sure that you have a fire extinguisher for the big injuries. Make sure that you have all your first aid equipment, and that you're basically got all the preventions for burns, and that's quite a big one. Then keeping things on countertops that people can reach and turn around and pull down again, it's also a big one. When using carving knives, they're electric, can amputate fingers. Don't put it on ice, just keep it in a bag and bring it through to your closest ED. A finger is important to a mom more than a surgeon, I think. Yeah, so I think that's one, the big one.
I know kids running around running behind the pets and cousins are coming over, which can frustrate many mums. But with that goes quite a lot of accidents with kids, like slips and falls. And, what sort of preventative measures would you advise?
So this is a daily thing with me. So I think I stopped mopping now. My son taught me a good one from Montessori. They have a no splash policy. So wash your hands, make sure they dry. Don't keep the floor slippery. Try not to mop. If you have to, wipe up quickly with a wet wipe. So big falls, they fall on the back of their head, dangerous one. Falling on the side of the head, also a dangerous one. I think keep kids occupied, word searches, scavenger hunts, crafts, anything, even if it's rice on the floor, as long as they're occupied. So out of slippery surfaces mainly. Kids must be in contained areas where you can see them, and that they mainly know there's house rules, no socks in the house. Slipping on is a big injury. They fall on an outstretched arm, they fall into someone else. It's dangerous. And I would say as well with kids, they must, if they have to, there are some kids I would recommend putting a helmet on. Putting their gear on, no riding any sort of stuff. They sometimes want to ride their bikes inside. I say if you have to let them in and it's more easy to create a little circuit for them around the coffee table, do it. It's safer, you can see them. And yeah, no point, keep your furniture very safe. I don't think you can keep up with times and kitsch furniture anymore. They will knock their corner off their heads and things. With babies, I'm guilty of it. I do put my baby in a walking ring. I try not to put her for more than an half an hour. Well, not that she'd let me. So they with you, they there, they nearby, and you put them immobile so you can see them. That being said, you don't want to mix age groups as well because they really wreak havoc. So if you could get a CCTV, or if they're a little bit out of your eye, just tell them you're watching them. I do that sometimes. Hope they're not listening. And be aware of them. They get out of hand. Have age groups correctly. Check on them. Hydrate them. Make sure they've eaten not too much sugar. They love fruit. That's a good substitute. Mangoes in season. There's lychees in every corner. Or give them something to do in the kitchen. I say that's also
And I'm
nice.
sure that, this time we like to spoil our kids and buy them some new toys. We have to be mindful, I guess, in terms of toys that we buy so that they don't choke.
Yes, so choking
Um,
has it's a big one. I've taught my 7-year-old how to do back slaps, so you have to know, you have to watch their mouths and things. Make sure you have age appropriate toys. I think the small Legos are completely out of the question. Any age group, kids are inclined up to age 8 to put things in their mouths. So small Legos, definitely. Batteries that are exposed, definitely a no. Screwdrivers that need to tighten them properly. Maybe stay away from those sort of things that need batteries out of your eye region. Anything that can be dismantled or that needs any electrical source or charging, you have to be present. So choking's a big one, and touching of batteries, ingestion of magnets. A lot of the toys now have magnets, and kids they very fascinated of magnets. Problem with a magnet is if it's in your intestine, you have connection between two bowel, and that can cause quite a serious emergency you need to get to quite quickly. With Legos, yeah, definitely keep away from the very small ones. Keep to Diplos or to any sort of bigger block. Wooden blocks are fine, and I would say, yeah, don't keep anything that's too small. Smaller than the 1 centimeters, definitely going to be ingested.
and what are some essential first aid skills to have during the holidays?
So I think everyone from the age of 5 is able to do a back slap. So you need to know how to do choking prevention. So monitor each other when you're eating. We actually do that. Are you talking? Can you say say your name? So I've eaten and you quiet all of a sudden. If you're alone, choking can be dangerous. You might have to, as crazy as it sounds, you have to maybe run into an object, anything that creates force onto your sternum. You need to expel that hazard. That being said, try not to eat anything dangerous when you're alone. The international sign for choking must be known so we can communicate to each other. So be mindful of each other. Take the time to pause, chew your food. So you should know how to do back slaps. You should know how to do the Heimlich maneuver. Be prepared to do it. If someone's pregnant, you might have difficulty getting on top of them. So above the pregnancy, or maybe from the front, any way that can expel it. And then the smaller kids, over your lap and back slaps to their back, 5 back slaps, so choking. And then another one is with drowning and CPR. You should know how to do bystander CPR and start that immediately. Getting someone out of water and starting active compressions, making sure the airway is clear. So any person who's become unconscious, age irrelevant, first open their mouth, check the airway, have them secure. If you haven't witnessed the injury, make sure nothing's in their airway. That's a big cause, obviously, for stopping to breathe.
Mm.
So you should be aware of how to check a pulse at the main points in the neck, the wrist, and you should be able to listen for breathing around the mouth. Those would save another person's life.
I think first aid should be mandatory at school. Basic
Definitely.
CPR,
Oh yeah.
and the little that you mentioned. And in terms of the season, I know everyone's traveling somewhere, going to visit someone out of the province, and traveling can be fatigue, and it's also
Yes.
dangerous in terms of the road accidents that we expect. What are some traveling precautions that you can share with our listeners?
I would first say travel if necessary. And if you're a good traveler, if you're someone who has been on the road a lot, then you be the driver. It is not the time to be on your first venture in and out. Stick to safe times. There's a lot of people, we thankfully don't consume alcohol, but there are people who do on the road, so be mindful of other drivers. Kids should know to be quiet in the car, and you have to, or maybe you tell them, watch around for me, watch that the cars, someone's are coming. There's also hijacking. You need to be aware at road stops. People are also desperate at this time of year. With that being said, charity must also still be remembered while we're spending and things like that. So on the road, keep to your speed limit. Stay off national roads during busy days. Try to get your traveling done well in advance by today, I would think. When in traffic, keep hydration items in your car. Keep the kids portable potties, bottles, whatever you have to. The last thing you need to do is stop for a toilet break at every garage. So keep rested. Stop to stretch. Make sure you're mindful of yourself and do you need a coffee break? Do you need to actually shut other things out? Yeah, so know your route, have it saved. Internet cannot be trusted. Google Maps sometimes can fool you around. So have a good old fashioned map, I would say. Have a good sense of your surroundings and know your how to sort of change a tire, how to be aware of what your car, do your pre-vehicle inspection. Not my topic, but I would say definitely know your car and have the items in your car that are necessary. So I would say everyone should have in their car. I know it's a lot to ask, but maybe invest in a mouthpiece or a mouth guard. You never know what you can come into contact with. If you have to be in an injury or a motor vehicle accident and you are there and an ambulance cannot get to you, which is an awful truth in South Africa with traffic and our road sizes, have the equipment that you need. There is a first aid equipment government pack on Take a Lot. If you could search that, I think invest in one. So if you're going to be on the road for long distances, plan your breaks, know your route, be aware of each other in the car, respect each other, and the driver needs to be treated well.
And I think most
Yeah.
importantly, Doc, and I like to contribute is buckle up.
Oh,
You could
yes.
be the safest driver,
Short
but
distance, even.
ensure that your babies are in those car seats. And as well, I was just making notes. Stay within the speed limit as well in terms of the pre-vehicle check. I know we have 4 seasons in one day
Oh,
in
yes.
KZN, so just ensure your wiper blades are good quality and oil free on your screen, and that pre-inspection. I did travel yesterday, and you got to prepare yourself that the tires are secure and everything else is fine.
And I think prayer also helps a lot. Be mindful of yourself. And so with the car seats, kids can be fussy. No matter how difficult they are, and this is after years of, I've been guilty of it, letting the bigger ones not on their booster seats, buckle them up. They will be comfortable. They will be fine. Nothing will happen to them. You have a mirror, any mirror would do. If you have to on a short distance trip, if you very much have to, put a lot of the car seats can go in the front seat on under 4 kilometers car distance trip down the road. But in a car seat, definitely. If you don't have an ISOFIX, you can make sure it's buckled up, make sure it's strapped properly, and give them something to play with. Anything. My daughter's playing with a little handbag at the moment. I know toys are overly priced now, so they must be entertained and have their bottle and access. Yeah, so don't get stressed, don't get distracted by the car seat babies. The bigger ones, over 1.2 meters or around 3 years old, must know how to buckle themselves and stay buckled throughout the drive. So don't overload cars. Take the trips that you have to. Yeah, and wipers are a big one. Visibility with the weather is so important. So stop, check your, when they say, do you need to check your oil and water? Please check it. It's important.
Eating out and experiencing gastric flu and or food poisoning. I know that we are going to go to the cirque and we're going to have some eats and treats. What advice will you give our listeners should they actually experience some symptoms of gastric flu?
I think let's start at the beginning. So I think of my good friend Tosh. She's always got hand sanitizer, and I think that's something important. Invest in one. They're everywhere after COVID. Have one on you. Spray hands if you can't get to a tap. Wash hands frequently. So that's a big one. Touching food from hand to hand. We eating with our hands. Hands carry a lot of germs. With eating out, make sure that you try not to order foods that are not cooked, could possibly not be cooked well. So when eating chicken, make sure you check that it's cooked well and that you know where you've eaten and that it's kosher inside, the kitchen sometimes at certain places it's busy, people are not up to speed with hygiene, sometimes shouldn't be, but it happens. When handling food on your own and meal preparation, dealing with raw meat, and make sure it's cooked thoroughly, make sure your hands are washed. And salmonella is a big one, big cause. When you actually end up with food poisoning, though, it doesn't matter what caused it. You're now, history or not, maybe just to prevent other people from eating that, or to remember what you did wrong, and make sure that you keep hydration up. So if you're vomiting and you're not keeping anything down, especially with kids, you need to contact a service medical provider. And that's mainly my big one that I do. So WhatsApp and or contact if they're not eating, keeping intractable vomiting, so not keeping anything down. You can do a tolerance test, small sips of their favorite, whatever it is. This is the time to give them their Coke if they want it. And a kid you'll know your kid. Moms know. So with adults and as well, you going to the loo very frequently, you've got a runny stool. If there's blood or mucus, that's very concerning. You need to get an antibiotic. You've got dysentery, and that's mainly from salmonella as well. So again, doesn't matter what caused it. Meal contamination happens. If you take the precautions, it can still happen, but be mindful. A big one is people asking what caused it, and as I said, only two things: hygiene or dealing with contaminants. So if you take those two precautions, it happens. So keep hydrated after that. Have your Imodium. And another reason to be concerned is, if there's blood or mucus in your stool, and if you are someone who has another chronic illness, you will get more dehydrated quicker if you're older, if you were already sick. So be hydrated and have your rehydrate with you. Whatever with kids, whatever they want to drink, have with them, and take the precautions. So yeah.
I know quite a few of our listeners are actually going to be going for Umrah and traveling out of the province. Deep vein thrombosis. I mean, what are some of the tips to obviously prevent that with the long travels?
So if you're someone who is known with the risk for DVT, if you have been on warfarin before, you know who you are. You need to have your TED stockings. It is covered on most medical aids. You can send me your form, I'll fill it out for you. Get your stockings. They're pricey. The orthotist will have it. The ones from Discam don't necessarily cover people who have DVT before. So those are the patients who are known with previous predisposition, and make sure you have your chronic meds. But I think we'll touch on that more later. With the long distance trips in the car, you can stop to stretch. The problem is immobility. So you might be on your feet or be in a car, but your legs are necessarily not moving, especially with automatic or these what cruise control cars drive for you. Stop, stretch, take a bit of a walk, or if you can get those compression stockings, if you really want to, those will compression for you and circulate. You need to get that circulation going. So I know hairdressers and doctors also, you think you're mobile, but you're on your feet, you're just standing, pooling blood in your veins. So I think that's a big one. So DVT prophylaxis is a big one on planes. You might be confined to a smaller seat. If you're taking a longer distance trip, maybe try to get a seat that has a bit more leg room if you can. If you can't, when the pilot allows it, stand up, stretch your legs, pace up and down, but get that circulation. If you're seated, calf raises can also, or just little ankle twists. I come from a family of veins, and they just got worse after each kid. Those moms will know if they identify. So you need to keep those veins circulating. And before that, exercise also can regenerate accessories. So yeah, circulation's a big one.
And listeners, please don't overload the car. Sometimes I'm at the
Catching is an
robot and I
art.
see the back seat and there's someone sitting over someone's lap, and it just adds to this fatigue, and it's just crazy.
Your car is having a DVT. You cannot over.
Yes. And I'm sure that everyone's got their holiday plans, and one of them is obviously maybe going to nature and hike. I love hiking, but with the warm conditions in KZN, you are going to actually stumble on probably a snake. And let's talk about snake bites. I mean, Doc, I'm sure you see this at your practice as well. Any tips on if you've been bitten by a snake during a holiday season, what can you do?
Okay, so with snake bites, this is snake season. Teach your kids firstly how to identify, be aware of snakes, not really go outside when it's very hot. If you are outside and hiking, be aware of which snakes to be concerned of. So have your pictures and identifiers of what a green mamba is. The green mamba really won't agitate you unless you agitate it. It happens. Another one is the adder, and then the black mamba as well. So identify your snake. You don't have to necessarily hunt him down and bring him with you to the ED, but get medical attention. So if you're bitten by a snake or bitten by something and you're not sure if it was a snake, and you have any symptoms within the first 20 minutes, even tingling, any dizziness, any calf pain, or wherever the site is, skin changes, please go to your local emergency department. They will have to source the anti-venom for you, and you don't need to necessarily bring the snake in. We just need so each symptom group would identify what type of anti-venom is needed. So be aware of any skin changes, tingling, so muscle changes, any nerve symptoms. And I think it's something everyone should read up a little bit about. If you think you've just been bitten by a harmless, bush snake, I know a lot of dads like to say, "Oh, it's just a bush snake." You still have to rather be safe than sorry. Get medical attention. It's never going to be a waste of time. It's something that can lose a limb or a life. So be aware of those.
And I know you're obviously a mom as well, and kids this time of the year, in terms of binging and trying to keep themselves occupied, is there any lifestyle tips in terms of what the kids can eat that is sustaining more health awareness?
I'm guilty of this, and we sometimes it's tiredness and you want to just keep them occupied, but it's never gonna work out well. So I would say spend the 10 rand more, go and get them fruit. Fruit is amazing this time of year. Mangoes, watermelon, and lychees, whatever you can get. Apples are great. Peel them, grate them. They love it. I would also say bananas keeps them full for long. Stay away from sweets. Their teeth is also another big one that suffers. So dental bills you don't want. So keep them with fruit. Fruit is great. I teach them to make themselves a sandwich of butter bread. They don't do it, but peanut butter sandwiches also protein. It's fine. Future Life. Stock up on those things. It might, in the end of the day, be more helpful than their Milo and their snacks like that. Stay away from sugary milkshakes. Rather have them have a glass of milk, put in some subja seeds or some, I don't know, cinnamon or vanilla, make your own vanilla milk. Make them get involved in the meal prep as well. And yeah, you don't need to spend a fortune. Make sure they just stay away from the sweets, cotton candy and the like. We all like to.
I think, Doctor, we have quite a few patients that are chronic in terms of diabetes, hypertensive. What sort of safety tips will you actually like to share with them?
A big one would be you're going to be on holiday, so make sure you have your chronic meds refilled. A big thing of why I started my practice is I have a relationship with Dischem. So wherever you go in the province, they have a network where you can have your script sent to them. If you run out, you get a holiday refill for 7 days. You need to have a little alarm and set, keep up with your chronics. Make sure that you take them. You don't want to be in a situation with a hypertensive or a diabetic. So keep up to your schedule and your chronic meds. Have it on stock. Know where your next repeat is if you're going to another town. I think it's fair enough to say you can even have tell your doctor or contact us to get your script with you. It's allowed now to send a digital script. Make sure you have that all sorted out. And with the diabetics, you know your limits and know how to monitor. The young diabetics, have your endocrinologist in communication with you. If you have to be in another town and have to go to that emergency department, a young diabetic is someone who their doctor would have to be in collaboration with the doctor in the ED. And hypoglycemia is another big one. So you might take your insulin or your metformin and you haven't actually eaten. So keep up with your schedule. I think maybe if you just stick to what you were doing before holiday, but keep in the holiday spirit, you'd be safer than sorry.
In terms of chest pain while traveling or driving, these things happen. Heat stroke as well, Doc. What sort of measures would you advise our listeners to take?
So with chest pain, first and foremost, any chest pain is concerning. Whether you think it's anxiety or heartburn, they're all equally uncomfortable rather. Pregnant women and chest pain and epigastric pain and reflux, rather check it out than be in a situation where you're too late. So if you have a history of cardiac condition or you are known hypertensive, previous heart attack, known to a cardiologist and you have chest pain, you need to have your next of kin hopefully with you and have the local hospital. You need to know where you need to go to in this emergency situation. As soon as you have chest pain, document the time the person is with you and get to the local emergency department. Ideally, get to a level hospital that can actually see to you with a cardiologist in the cath lab. I know it's a lot to ask. You don't want to be rerouted and get authorization here and there. Difficult one. So your ambulance, when you call them, if you have a partner who has chest pain, on the phone, it's important to let them know this is a previous cardiac patient. Whatever it is doesn't really matter now. They need to know that predisposition, the time of onset of chest pain, and the description. Is it crushing? Is it sharp? Is it tearing? These are the words used. And you rather be at the ED, get an ECG with the ambulance, and make sure that you actually hopefully have anxiety or heartburn rather than a heart attack.
In terms of self care and mental health during the holidays, is there any tips that you'd like to share with our listeners?
I think this is a big one, Shabnab. I think, especially nowadays, we all are not aware of ourselves. We tend to just pull it off. And it's important with your partner to speak about things that concern you. This is a time of year where any sort of extra pressure can push you over the edge. And, even verily with hardship, you are blessed at the end when you need to be aware of where you've come from. Keep those things in mind. Don't over expend yourself. So mental health is also made worse by sleep hygiene worse. So if you are someone who suffers with depression and you're on medication, keep up with it. Be aware of yourself. If not, and you are concerned about yourself, speak to someone. There are lots of helplines. Get help earlier rather than later. Don't overwhelm yourself.
I know that there's going to be lots of holiday sports, and swimming is one of them. In terms of potential drowning and sunscreen while playing these sports, can you actually just delve into the importance and give us some tips for the mothers out there when the kids are in the pool or maybe going to the beach?
With kids, if you can avoid pools, I would really honestly advise avoiding. I would also advise in future to get swimming lessons done. I regret not sending my daughter. She is now in school and they don't actually do it in school. So you need to get someone. There's lots of swimming schools. Be swimming trained and be aware of how to swim and how to be safe. If you are doing water activities and you're outside in the sun, choose proper hours. Rather do slip and slide than in a water. But if you're in water, someone needs to be monitoring life jackets, floaters, properly checked, properly weight allocated, and know how to do CPR.
Listeners, as we come to the end of our discussion on holiday safety, I want to thank Dr. Maharaj for sharing her invaluable insights with us. Any final words, Doctor, and how can our listeners get in touch with you?
Yes, I am happy to help anyone. As I say, I don't charge immediately. So the number we can share on the show, I can give it to you now. If you write it with a pen, it's 083-8423-007. Or you can Google Dr. Joe and it'll come up on Facebook or wherever. Or by word of mouth is also another one. Get in touch with us and I will help you. And then don't worry about the rest.
So, Doc, that WhatsApp number is actually quite vital because if a traveler is traveling and they're experiencing some sort of challenges medically, I'm assuming they can, within a reasonable time, maybe connect with you and you can plug them into a nearest healthcare center.
Yes, so we call it care coordination. So I make sure that you call me, and as I say, we make sure that you go to the correct facility. I'll call that ED, tell them what to expect. They're expecting you. Even do your pre-authorization, book your bed, make sure the specialist is aware. All of that smooth processing, so the nitty gritty is done, and you just have to get the fastest way possible to the best facility suited for you. Because a lot of the stress sometimes is my medical aid going to cover it? Can I go to a public facility? Can I go to a network hospital? Is there co-payment? And that in itself can make any chest pain worse. So I take care of all of that. So you can just go and get seen. And you have your story told as before you get there. So everyone's ready for you.
Doc, your expertise has been enlightening, and we are so grateful for the time you have taken to guide us. And we'd also like to wish you and your family all the best for the holidays and have a safe one. Listeners, shukran for tuning in today's episode. Healthy choices, brighter futures. That's our motto here. And we believe that taking care of your health is one of the most important investments you can make.